Reason to hope. As of moments ago, more than 100 million Americans, nearly 1/3 of our population, have now received at least one dose of a COVID vaccine. That from the CDC, which also offered a pretty solid argument today for getting the jab. A long-awaited update to its travel guidance that says fully vaccinated people can start traveling within the U.S. 2 weeks after their last dose at low risk to themselves. They do not need to take a COVID test before or after those trips, and they do not need to self-quarantine when they get home when traveling domestically. It is a clear reflection of the latest real-world findings about what fully vaccinated people are less likely to contract and spread COVID. The CDC director offered the encouraging next step, though, with caution.
For example, fully vaccinated grandparents can fly to visit their healthy grandkids without getting a COVID-19 test or self-quarantining, provided they follow the other recommended prevention measures while traveling. And while we believe that fully vaccinated people can travel at low risk to themselves, CDC is not recommending travel at this time due to the rising number of cases.
Let's bring into our conversation MSNBC medical contributor Dr. Vin Gupta, affiliate assistant professor at the Institute for Health Metrics and Evaluations and a global health policy expert, and someone we turn. Take me through how you see the country's fight against COVID today.
Hi, good evening, Nicole. Good to see you. In the U.S., it's a different conversation than it is globally. So let's start in the U.S. There are pockets that are concerning, where we're seeing increases in cases, followed, Nicole, critically by an increase in hospitalizations, namely places like Michigan, where we're seeing that important increase in hospitalizations. And that's what I want all your viewers to really focus in on. As we get more vaccinations in people's arms, the key metric here when we talk about normalcy is how many people are going to the hospital. Because less people are going to be getting tested if they got the vaccine. We really want to key in on that metric. So what's happening in Michigan, there's a blip upwards in terms of younger people getting hospitalized. So that's something to keep an eye out on. It should all cause us some concern because we know this variant, first identified in the UK, B.1.1.7, we do think it might be more lethal, slightly more lethal, more transmissible. And what I've seen personally, Nicole, I'll say, I just came from a week in Arizona, in an ICU, younger people infected by this virus. So for all those young people out there, you are not immune. This is a very uncertain virus. So there is some tenuous fragility to our progress here, Nicole, but progress.
So you're talking about young people. Are you encouraged then by the states? I can't remember at the moment how many of them have opened up vaccine eligibility to anyone 30 and over. Is that an overdue and necessary step?
Oh, God, it is absolutely necessary. And let me just say, let me be as specific as possible because we don't lean enough into storytelling, in my view. I cared for somebody that was in their mid-30s, otherwise healthy, that ended up having a complication from COVID that's rarer. It's called Guillain-Barré, but it's basically the entire body gets paralyzed. It's a side effect of other viral infections also. But it's uncertain. You can't predict it. I've had young people as young as 18 come in with strokes. So to all those young people out there that think they don't need the vaccine or are invincible, this is an uncertain virus. We don't know how you may respond to it if you get infected. So get the vaccine. And we need to be messaging on that very critically because that's the key group now. Young people, making sure that they stay vigilant, but get the vaccine when they're eligible.
So I might have looked at how to go to a baseball game in the COVID era. And I learned that one of the ways to go to a baseball game in my area is to either have a vaccine card or a PCR test. You are helping another baseball team bring fans back safely. Talk about how we do baseball right now in America.
Well, the simple way would be to not do what the Texas Rangers are doing and follow a different playbook. With the Seattle Mariners, I have to just give them credit. I was advising their startup, making sure that there's capacity limits. So in the case of the Mariners, there's a quarter of the stadium full, where we have pods that are socially distanced from each other that only have household members in those pods. Ideally, you want to make sure everybody's wearing a mask. So we instituted that very strict guidance. You want to make sure that you have social distancing ambassadors throughout places that are not well ventilated, bathrooms, near the various food stalls, for example. You want to make sure your food stalls have grab and go food. And in some cases, like the Giants, they're actually mandating a vaccine or proof of a COVID-19 test, one or the other. I also think it's a great idea. There is a way to use common sense to safely reopen up ballparks. Mariners are doing it. Other ballparks are doing it. The Rangers are not doing it. So don't do it. So follow common sense. And if we follow common sense in the guidance of the last 12 months, it's not that hard.
Dr. Gupta, it's also this point in the vaccine where people need things like that. So I wonder how you got involved in helping the Mariners.
I think they probably saw me on your show, Nicole, and they said, let's reach out. And so I think maybe that's how. But no, it's been a pleasure to work with them and others. But and so we're all just trying to help. And I agree, we need this for mental health, and we can do it safely.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.